Right, ladies and gentlemen, we are at the last session, but this is a topic which really affects everyone in the world, as far as I can see, either people who get cancer, their families around them, and indeed society generally. So to explain why we have created and we're launching today the global cancer ecosystem within the Global Health Connector. This is a topic, a worldwide topic. It is full of initiatives, full of fantastic research, fantastic innovation. The difficulty we have discovered in listening to our 90-plus ecosystems is, how do you know what's happening in the rest of the world? So the first thing it's meant to do is to collect examples from around the world, bring them together in one place, so connecting the dots as usual. That itself is a service which lots of people have asked for. Secondly, we find people, give an example in Africa, in Abuja in Nigeria. One of our ecosystems there is actually run by the Cancer Network of Nigeria. And they have done incredible work, but they have no visibility, to the rest of the world or from the rest of the world. So the idea of launching this cancer ecosystem, thematic one, is simple. We believe that by collecting all of these initiatives around the world, then we can act with a collective voice, which is stronger than any one person's voice on their own. So we've been fortunate enough to bring together a steering group with Eduardo, who you'll hear from in a moment, then Mark Lawler, and another member who's not here today, Maurice Gianta, who some of you will know, based in Bucharest. And we have put this together so that we can connect the dots in cancer. We have a whole program worked out. You will be invited, those of you who are doing cancer initiatives and so on, public and private, and foundations and so on and so forth. So you can join. Free of charge, however, nothing's free. What we want from you is not money in this case, but actually an undertaking, a commitment that you will contribute to this. We don't want logos for the sake of logos. We want people who actually are genuinely interested in making global connections. So that's the purpose of what we're doing. That's the methodology. There's a QR code, I think, coming on the screen, I think, at the end of the session. If you have connections or you're interested yourself, please take a note and join us. And with that, I'm going to hand over to an expert on cancer, because I'm not, and that's Eduardo Pisani. Eduardo.
Thank you very much, Brian. Good afternoon, everybody. Thank you for the privilege and the opportunity to be here and represent the organization which I lead. It's called All.Can International, and it focuses on cancer care. The first thing I think we should underscore and emphasize as much as we can is that the numbers, the figures are staggering. Let me start with this. Cancer incidence, to be precise, is increasing everywhere in the world. There are figures that the WHO, IARC, which is the WHO agency for cancer research, have recently published. We're talking about a 76% incidence increase over a period of 20 years. So by 2050 approximately, there will be about 20 million deaths, which correspond, if you think about it, to 2 medium-sized EU member states. It's almost like wiping off, with all due respect, the Netherlands and Belgium. And this is associated also with significant costs. In fact, the calculation, which is an estimate, of course, indicates $25 trillion as the cost of cancer care for the next 20 years. So we are very, very passionate about this subject. We are very committed to the cause because it's about improving health outcomes, first and foremost, but it's also ensuring the sustainability of cancer care, let alone healthcare systems at large, because the aging population, the fact that cancer is often associated with other pathologies, other morbidities, extends the cost and extends the challenge well beyond cancer care in itself. So the idea, as Brian has anticipated, is to create an ecosystem, a large network, which can allow for collaboration, and it can allow for action that spans globally across regions, that is evidence-based and therefore allows the transfer of knowledge from one part of the world to the other, however targeted on very concrete, very tangible, good practice, if you prefer, solutions that can be implemented locally. Perhaps, Mark, you want to go ahead and illustrate the mission.
What I want to do first is I want to get everybody to stand up. Everybody stand up, please. Okay, we've been sitting down for the last 3.5 hours. Sitting is the new smoking. So what I want you to do is all of you, for 30 seconds, to actually do something. So come on. You guys, come on, everybody. Come on, get moving there. Come on, that's not going to be any good. Get a bit of movement in there. Come on. Very disappointing. You're all failed. Why did I do that? The reason I did that was because we need all different types of people working together to cure cancer. In relation to exercise is very important in terms of cancer prevention. It's also been shown that it's really important in terms of recovery after, for example, treatment with rectal cancer surgery. So it's really important, and what we want to do is try to bring together everybody who's involved in cancer from all aspects. We don't want 20 oncologists. We want a football team that has everybody represented in it. And that's why we're reaching out to you. And we've already brought together a global ecosystem in what we've called as a crucible for cancer collaboration. And collaboration is the word you'll hear a lot from us in the global grouping, because we really feel that collaborating on its own is not enough. We need to really take action as well. Next slide, please. And there's 3 areas or 3 pillars that we've focused on. The first is social and equity dimension. It's really important that we look in ways in which we can address the equity issue, because the equity issue is going to get worse unless we do something about it. If we look at it in relation to, by 2050, 70% of the cancer deaths are going to happen in LMIC countries. That is not acceptable. So therefore, we need to look at what are the type of solutions that we want to look at that actually work for everybody, not just for certain countries and certain parts of the world. The second thing is, how do we look at capacity building, but capacity building in a way that's actually fair, but also in a way that's truly collaboration, working together, looking at the best solutions, looking at South-South and North-South issues so that we can really reduce those global inequities. And then the third is that digital infrastructure that we've already heard in a number of the talks today, which is really critical, because we had a meeting earlier and we were just talking about what we can do in Africa, for example. We can leapfrog a lot of the situations to actually get to a digital approach that actually is much more relevant to Africa as it is today. And we really see that as opportunities that we really want to do in much more detail. Hand back to Eduardo.
Thank you very much indeed. Now, why are we doing this, and why it is important to join the global cancer ecosystem? I think that the mission is crystal clear. Mark and Brian have outlined it very well. The burning platform, I believe, is also very compelling. The fact that the global health connector can connect the dots and make sure that we create a synergistic approach in a very complex, and I would say also in a very crowded environment, which is the cancer policy and cancer at large. This brings us the opportunity, as we were saying, to make sure that we avoid fragmentation. Avoiding fragmentation can accelerate impact and can accelerate also the availability of solutions in different parts of the world. Now, another distinctive factor that we would like to submit to your consideration is the fact that we should not only be talking to the cancer community. There is also the non-cancer community, which has got technological innovation, which has got social innovation solutions, ideas that can be very, very relevant throughout the cancer care pathway. And the fact of having these transferable insights that can strengthen healthcare systems. This is something which is definitely open to everyone and that can help creating a critical mass and at the same time a share of voice and an impact that allows us to talk and advocate externally also to decision makers. One point, Mark, which was touched upon earlier this afternoon, has got to do with the fact of making sure that the health and wealth concept is well understood everywhere. In other words, it's necessary to convey investments, technology, new technologies, innovative solutions into a sector which definitely can generate wealth and which can make sure that outcomes improve on a very, very systematic basis, on a very measurable basis. Two examples, I think one was given an hour ago or so. Let me give you two examples. Investing in HPV vaccination implies that each dollar spent will generate nearly $4. For early detection and early care treatment of breast cancer, the ratio goes up to 8 times the original investment. Mark.
And what's really important as well is how we learn from each other. So I'm just going to give you an example. Denmark in the 2000s had the worst cancer outcomes in Europe. So they looked to see what was going wrong. And one of the things they saw was they actually had the lowest number of radiotherapy machines per million population of the entire of Europe. So what did they do? Over time, they invested wisely to actually build up their capacity so that they became the second highest percentage in relation to radiotherapy machines per million population. And then that showed them that that was actually the reason why they were having such poor outcomes, because their outcomes came to such a degree that they were then, by 2024, the most improved outcomes for cancer patients in Europe. So again, showing data to show what the problem is, but then using that data to find the solution. And I think one of the things we want to do is very much learn from each other. You have to remember, cancer knows no borders. We talked about silos, but we also have competition. We should not be competing against each other. We should be competing against cancer, because cancer is our common enemy.
Thank you. And that's why, and that's exactly why we believe that the global cancer ecosystem is complementary. In fact, it's a valuable addition in the cancer ecosystem at large, globally, because it allows to do all these things that we have just listed. And one of the reasons why we've insisted on the collaboration, as it has been defined in our recent discussions, is also based on this survey, which was carried out by the GHC, and which clearly says that collaboration across regions and sectors is the #1 motivation, or could be the #1 driver for bringing together everyone and again, allow me to repeat, connect the dots and create synergies. If we all operate separately, I don't even want to say in silos, because all ideas are good, all initiatives and programs are valuable and meaningful. However, if we bridge them, if we connect them, the impact will be exponential, for sure. Members.
So you can see there are quite a wide range of members, but we want more of you to join us. So what are you waiting for? Come on board.
Yeah, there are several people who have already started responding to our call. Let me perhaps add another item which goes also in the direction of sustainability of healthcare systems. And once again, this is fully in line with the strategic direction that in multilateral organizations, international organizations such as the WHO, the OECD, and in the case of Europe, the European Union, the European Commission more specifically, are taking. Efficiency can be also accelerated thanks to new technologies, thanks to the appropriate use of data, as several speakers today have outlined. Improving efficiency in a healthcare system implies avoiding wasted money. Incidentally, the organizations which I mentioned, OECD and WHO, have issued a report that says that up to 40% of the money invested in healthcare around the world are wasted for different reasons. This is also something which speaks to the importance of joining forces, of getting together in order to ensure that investments deliver results and deliver, first and foremost, health outcomes. Mark.
And just to end with, really important, that point in relation to data and data intelligence. And remember, data trump opinion every time.
Yeah. So there is a list of proposed activities that we have here for your consideration. Clearly, they will be beefed up with very concrete actions and very concrete proposals shortly. As soon as we have several other human resources who are part of the ecosystem, I believe there is also a QR code. Yes, if you would like to join the cancer ecosystem, please check this out and let us know. Thank you very much indeed. Thank you, Brent. Thank you.
So to finish off, first of all, please listen to those pleas and requests. One area we talked on earlier this afternoon was about the economy and the economic impact of the social impact is obvious. We all have either know family, friends, relatives who have cancer, had cancer, died from cancer, still living with cancer. So the social impact is huge. In terms of the economic impact of cancer, I don't have a number at the moment, but it is frightening. Think about it from the point of view of finance houses and venture capitalists. One of the things we hope to do in September when we go to the UN is actually to take the Global Health Connector to Wall Street. So, as you know, I'm determined to get health, science, finance, and the economy together. And why would we wait and ask them to come to us? So we're going to them. I'm doing the same thing in Washington World Bank. We're going to the financiers saying, here is how you should invest and why you should invest in prevention of cancer. Think of the impact on the employment situation, on the number of people available to be employed. So there are all sorts of aspects of this, which I must be honest, when we started looking at this, I had not thought of myself. I've been educated significantly by these gentlemen and by Federica from the Global Health Connector. And thank you, Federica, for all the work you've done. So, answer, we have no choice. We're already in this together. And we just want more of you to join us and support us with all the initiatives that you're all involved in. So I appreciate that. Thank you very much. Thank you.